So this is another autoimmune disorder. This time, your antibodies are attacking your joints, the connective tissues of your joints. More females are affected than males. As with any other autoimmune disorder, we have no idea what causes it.
1067. 1067.
So what will be the manifestations if the patient has antibodies attacking their joints, the synovium of your joints?
Pain.
Pain is the patient's number one concern here. Pain related to activity, so joint stiffness and pain, redness. This is a chronic condition, so therefore there will be good days, there will be bad days, there will be exacerbations or flare-ups. Diagnosis wise, there's really no one test that will confirm rheumatoid arthritis. The reason is some of these tests are not exclusive to RA. For instance, a positive rheumatoid factor is not exclusively found in rheumatoid arthritis. It's found here. It's also found in multiple, in MS. Or lupus also has a positive RH factor. Systemic sclerosis is also positive for the RH factor. Okay, so therefore it's not, do you know what I mean? There's no single test that will confirm you have rheumatoid arthritis. It's clinically diagnosed. So they'll take all your test results, say your ANA, positive ANA, anti-nuclear antibody, the RH factor, and then the others will be, they'll do aspiration of the fluid in your joints, okay, to determine if it's an infection, for instance, septic arthritis, something like that. And then put everything together, like the inflammatory substances, ESR, CRP, along with your symptoms, and then they'll make a diagnosis. All right. Unlike osteoarthritis, which mimics the manifestations here, osteoarthritis is a wear and tear problem. It's not an inflammatory autoimmune problem. Make sense? So manifestations may be similar, but treatment definitely is not. Okay? Because what's the only treatment for osteoarthritis, which is wear and tear? All of us will eventually develop osteoarthritis because it's usually age-related. Whereas rheumatoid arthritis does not respect age. So this is not an old person's problem. This will affect younger people as well, as early as 20 years old. You can have rheumatoid arthritis as early as in your 20s. So here are the manifestations. Joints are hot, swollen, painful, especially early in the morning. They get better as you move it throughout the day. However, if not treated, the patient will have deformities of the hand. We have some pictures here. I think maybe not. Okay, so these are rheumatoid arthritis hands. So tell me how you're going to button your shirt, open the doorknob, steer your steering wheel, do your paperwork after you do number 2. Can you do all that? Okay. And this results from not treating rheumatoid arthritis. Okay. So do you want to treat it or no?
Yes.
Okay. Now, the treatment, of course, because what's the condition here? What caused this in the first place? Autoimmune disorder. And what did your antibodies do? Destroy what? The joint. Okay, it destroyed the joint. Okay, so that's why the joints, especially in your fine motor joints are affected here. So this will cause disability. Now, do you want to do that in your, let's say in your 40s, you already have these hands here in your 40s because you did not treat it, and you're only 40, right? So the patient will have pain throughout the day, more severe during exacerbations or flare-ups. Early in the disease, again, these are your manifestations, but later on, they will cause the deformities. Another complication of the disorders are Raynaud's phenomenon. Have you heard of Raynaud's phenomenon? What does that include? Okay, so some people with rheumatoid arthritis will develop Raynaud's phenomenon. So their palms and their fingers will turn blue when exposed to cold and stress. So even if it's not winter, even if they're not in a freezer or a cold room, stress can trigger the condition as well. And same thing here, rheumatoid arthritis is also triggered by stress. So they can have acute exacerbations, also called here, cold and stress induced. Okay, so the exacerbation, the flare-up will also be triggered by stress. So can you have exacerbations during exams?
Yes.
Another uncomfortable condition that will develop among these patients is called Sjogren syndrome. Everything goes dry, from your eyes to your mouth to your rectum, even your vagina will get dry. Okay, so you will lose lubrication, causing really painful intercourse, extremely dry mouth, hard to swallow.
Why?
We don't know. It's called Sjogren syndrome. Okay, these develops in patients with not only rheumatoid arthritis actually, but most connective tissue disorders. So you'll see this again in lupus, SLE patients, lupus patients. Let's go to manifest treatment now. What's the nature of the disease? Autoimmune. So what will the treatment entail? Immunosuppressant. So similar to what we saw in myasthenia gravis. But these though are specific, almost exclusively treatment given to RA patients. Some of these are expensive. Let's start with the cheapest ones first. So the cheapest treatment is methotrexate. It's available by mouth or IV infusion. So most people are started on methotrexate. However, it is a teratogenic, and can female patients here be affected between 20 and 40 years old?
Yes.
Yes. So are those sexually active age? So can everybody take methotrexate? No. We'll talk about more these other treatments shortly. So for methotrexate, so that's the consequence. It is teratogenic, so pregnancy. So what does the patient have to do while taking it? It's teratogenic.
That's different.
Okay, must have at least two contraceptive methods, okay? Because you don't want to get pregnant while taking this and then find out later. When do you usually find out you're pregnant? On the first day? And like 2 months later, right? You're already 8 months or later before you find out you're pregnant. So all this time you were taking methotrexate, what does your baby look like now? Like a frog. Okay. All right. Yeah, this is teratogenic. So who knows what kind of baby you'll have? It could be a frog, a lizard, or right. So it's really important that the patient carefully plans pregnancy while on methotrexate. Okay, so if they want to get pregnant, discuss it with the doctor. They'll be taken off methotrexate. The rest of the treatments are now very expensive. So let's start with TNF-A inhibitors. So this stands for tumor necrosis factor agents. There's actually a long list. There's a table on this page. We have interleukin-1, interleukin-6 inhibitors. Now, what are these referring to? So these are cell-specific white blood cells, meaning these are specific parts of your immune system responsible for the manifestations of RA, meaning these are the immune parts of your immune system that cause the joint swelling and inflammation. So therefore, is it wise to suppress the entire immune system or only the cells that are responsible for the RA symptoms? So we have to treat it's wiser to do targeted therapy, right? So you take medications that are specifically going to affect only the responsible parts of your immune system cells. Okay, not everybody, because do you want to suppress the entire immune system? No, because otherwise, will you get TB? Yes, you'll be easily infected with common disorders. So what do you think the commercials will say on these medications? Let's say on etanercept, which is Enbrel, okay, or let's say Humira, which is adalimumab, which is interleukin, it's also a TNF-A inhibitor. So what will be the commercial? What will the commercial say as a warning? Okay, so before starting Enbrel, tell your doctor if you had TB or are prone to getting TB, right? So if you, or let's say they will say, if you have an infection, don't take Humira if you have an infection or are prone to getting infections. All right. So these are the warnings, because what will these drugs do? These are immunosuppressants, okay, causing havoc on your immune system. Again, these drugs are expensive. All right. Your insurance will cover most of them, but you'll have a really high copay. Steroids are only used as a bridge in the early treatment. We really don't want to put the patient on long-term steroids here. Steroids are non-cell specific. They inhibit the whole thing. They inhibit the entire immune system. And not to mention, have you talked about Cushing's in the past? No. Okay, we'll do Cushing's next semester. Long story short, Cushing's, you'll look like this. If you're taking steroids for life, this is what you look like. Let's look at a real person.
So someone that takes corticosteroids for asthma.
This is a woman.
That's a woman? Wow.
This is a woman. That's what Cushing looks like. You understand? So you want to take steroids forever? Okay.
What about the person that has asthma? They gotta take it forever. They'll end up.
No, it's not. It's not true. That's not forever. It's only periodic.
If you have chronic
yeah.
asthma.
Huh?
If you have chronic asthma.
You're taking oral steroids? No, this is oral steroids. Okay. Yeah, forever. Let's say transplant recipients, those kind of things, they take steroids forever. Or those with adrenal problems. Again, we'll talk about those next semester. For the pain, these are the options. The patient will be taking NSAIDs, but because NSAIDs can cause ulcers if taken for a long time, and only NSAIDs really work for these patients, they're not going to benefit from opioids because this is inflammatory in nature. So NSAIDs will be the only one that will help. So we're going to give them never mind, it's not mentioned here. We're gonna give them misoprostol. Have you heard of misoprostol? It was in the news lately after Roe v. Wade was struck down. No, the abortion pill. Okay, so misoprostol is an abortion pill, but it wasn't designed for abortion. It was actually designed for preventing ulcers in patients taking NSAIDs. They just discovered the drug causes an abortion, so that's why it was used for abortion, right? But that wasn't really the intention for the how the drug was invented. Okay, so once you have moderate to severe rheumatoid arthritis now, so you're no longer benefiting from methotrexate. So now we're going to use the immunomodulators now. So let's look at where's the table? Oh, there's no table. So you're stuck with the paragraph. All right, so just stick to what the paragraph is, which is not bad. Yeah, it's not bad. All right. Not that detailed. But what's the commonality for patients who are taking these types of drugs? What do you teach them? Based on the effects of these medications? Yeah, but what's their effect? What do they inhibit again? So therefore, what's your concern for patients taking these types of drugs? Okay, so hand washing, okay, stay away from people who are sick, wear a mask, right, in crowded places. Do they go party? Okay, do they take flu vaccines? Do they take COVID vaccines? All right. Let's go to nursing care now. What do we teach the patient? Now, people with, let's say you are, again, between 20 and 30 years old. Who are between 20 and 30 here? All right. Let's say, imagine you have rheumatoid arthritis. Okay, you have the joint pain, disabilities, are you in bed? Say, I don't want to go to school. I don't want to go work. How you feel? Your friends are calling, hey, it's Samantha's birthday, yeah? Come on, it's party, okay? Going to this bar, okay?
You don't feel bad.
You can't go, right? Yeah, you can't go. It's high risk to go to a bar, right? I mean, people are smoking there, whatever they're smoking, and then here you are taking methotrexate or any of these immunomodulators. So what are you gonna say?
I can't.
Yeah, so now they're talking about you, right? And then how you feel.
Sad.
So what are you gonna require also? Because now you're gonna develop depression. Okay, so now you're gonna require antidepressants, probably therapy at the same time. All right. So it's not easy. And then because now you're at home, you're depressed, do you now tend to eat a lot? and then now you gain weight.
Yeah.
Does that help the condition?
Yeah.
You get more depressed?
Yeah.
Okay. So here's nutrition. As far as, let's go now to the activity. So to promoting mobility. What we're gonna have to do is, how do we improve mobility? So what is advised here? Do we take a shower or a bath?
Shower.
Why a shower?
So they can't get up.
Okay, because if you take a bath, you may not be able to
Yeah.
get up easily. Okay. What do we encourage them to do? Exercise a lot or take plenty of rest? You have swollen, painful red joints. Okay, plenty of rest. Because remember, what is this? What causes RA? What triggers an exacerbation, a flare-up? Cold weather or stress will cause. Is exercise stressful?
Yeah.
What type of exercise then?
Cardio.
Okay, so really vigorous exercise is not good. Okay, so the guideline here is if it's painful, do we exercise it? No, if it's painful and hot, red swollen, that's no time to exercise. That's the time to
Rest.
ice it. Yeah, rest it, ice it. Okay, it's hot, swollen. So ice it only 15-20 minutes at a time and then and then stop the ice. If you're feeling good, then keep it that way. Okay, we exercise. If the joints feel good, okay, go exercise, but make sure you get plenty of rest. Okay, so intervals here. Intervals between activity and rest. Make sure naps will be good. Okay, they take naps in the afternoon. That's good for arthritis. All right. Do you encourage smoking? Okay, smoking cessation would be good. Some of these medications are injectables. Let's say Humira or adalimumab is, which is a TNA inhibitor. That's a subcutaneous injection. So you may have to teach these patients self-administration. Right. So these are your. Let's go to the chart. So these are your problems. One is pain. And how do we manage the pain again? What drugs do we encourage? NSAIDs and rest. Okay, so don't forget the rest. And then it should be alternate heat and cold. So cold, 15 minutes, rest, and then hot or heat, another 15 minutes. Okay, nothing continuous longer than 20 minutes. Here's the fatigue. So another reason for the rest. Okay, balancing activity and rest. What type of exercise would be good here? Example. What are aerobic exercises? Would swimming be best here? Say, what if the pain gets so severe and you're in the water? You're at the 8 feet level. Okay, walking would be best, all right? Or you can go swimming, but make sure you're in the, maybe 4 feet, okay? So you don't necessarily drown. Okay, so pain, mobility, self-deficit. And remember, these patients are depressed. Okay, they have anxiety. That's about it.